I bet you didn't know there's over 26,000 different named diseases in the world, all due to the fact that the brain is not sending a healthy message to the body. Upper cervical care is based on the upper cervical spine, where there's interference into the spine, and the brain is having a struggle, a hard time sending a healthy message to the body. What's so frustrating for me as a doctor is when I hear a patient come in and says, "No, doc, why don't you just take care of my wife or my husband or my child? Don't worry about me, I'm feeling okay right now." How do you know that? How do you know you're working the right way? Literally, how do you know the brain is sending a healthy message? Why is it that women tend to get breast cancer in one breast, not both? Why do men get testicular cancer, one testicle, not both? Why is that? Why is that one side compensating, causing that body to become ill? Why is it that your daughter developed into asthma, sports-induced asthma, at 11 or 12? Or your son got irritable bowel at 17? Or you just developed into migraines at 35? Don't you think there's something wrong with your system? Something wrong with the body's ability to maintain itself and keep itself well? Every nerve in the entire body all comes up and meets at the base of the skull. And in the event that there's interference, some parts of those bodies break down. Christopher Reeve damaged that top vertebrae that I get to work with. He shattered that vertebrae, and look what happened to him. I'm not saying your vertebrae is broken, or it's sprained, or twisted, or... No. All I'm saying is you might have a little bit of distortion. If you have your favorite radio station, let's just say 100.1, I don't know, let's just say a radio station, and you turn the radio station dial, now it's 100.2. You can still hear the music, it's just a little fuzzy. The messages are still getting down to your spine, they're just a little fuzzy. You see what I mean? Just that slight distortion. And then over time, the years of breaking down, the body grows into a condition. So if it takes time for the body to get sick, it must take time for the body to rebuild itself well again. Oh, I got such a headache, I need a Tylenol. Are you lacking Tylenol? Is that why you have a headache? Of course not. You don't lack a medicine, anything from an outside-in substance. If the body needs to make it, it will. We have the best doctor and pharmacy inside of us. It's just incredible. Upper cervical care just opens that door, opens the door to your possibilities of tomorrow, restores that body's functioning, allowing the brain to communicate, and then allow the body to communicate back with the brain, like a big safety pin. That's what upper cervical care is about. It's about giving the life an opportunity. It's about giving that innate intelligence an opportunity to work and function. Remember, upper cervical care is based on how well your body's functioning, not necessarily how well you're feeling.